Hi everyone, my name is Sang-Hoon Lee at Kyunghee University College of Korean Medicine. I'm very happy to introduce you principle of SaAm Five Element Acupuncture. This is a meridian-based holistic approach. Today I'll talk about some current challenges in acupuncture practice and research, the importance of meridians, and the SaAm acupuncture. In this presentation, I'll more focus on the general introduction of SaAm acupuncture and its basic clinical application. This lecture is for advanced practitioners who already know meridian theory and acupoints in traditional East Asian medicine. Let's talk about headache as an example, as it is quite common. A headache includes many manifestations, as you see in these pictures. People experience headache in the side, back, top, or forehead areas. What will you do if these people, or even a dog, visit your clinic for acupuncture? When you look up points in the reference books, there are a lot of acupuncture points listed for a headache. Some examples are given on this slide and the next slide. As you see, tons of acupuncture points are recommended for headache treatment. This looks very complicated. Having many options may be better than nothing, but too many is not good either. You have to establish your own principle to select and combine acupuncture points. What is your principle for your acupuncture practice or research? If you don't have any specific criterion as a whole, or if you think the more points the better, then you might do this type of acupuncture. But I believe none of you prefer this style of practice in your clinic because it is too scary for patients and it is hard work for practitioners as well. I'd like to compare acupuncture to making food. When you prepare a meal for your guest, how do you choose your ingredients? Good cooks don't just select the most used ingredients in cookbooks because combining common ingredients cannot always guarantee the best results. How about acupuncture? We can often find that investigators select the most frequently used acupuncture points after literature review. This might be successful, but if it fails, what could be the next choice? Do we have to select the secondary common points for the next trial? Maybe not. We need to analyze whether we have a rationale for selecting points rather than simple combination. The beauty of SaAm acupuncture is that it is a meridian-based approach. The result is a holistic and systematic balancing of organ functions, rather than simple stimulation on local lesion area. Moreover, it is comfortable and safe to apply because typical needling points are located in the legs or arms. According to the classic book Compendium of Acupuncture and Moxibustion, there is a saying, "You may miss the point, however, you should not miss the meridian." This sentence emphasizes the importance of the meridians in acupuncture practice. SaAm acupuncture was named after the founder SaAm. SaAm acupuncture is often called as four-needle technique in the USA. SaAm was a Buddhist monk in Korea, but his personal biographical details are unknown. Bibliographical research has concluded that the manuscript is approximately dated between 1644 and 1742. Currently, in Korea, there are 8 handwritten texts and 6 printed texts handed down, but more may exist. The classic book consists of 43 chapters. Each chapter includes an outline, pattern identification, acupuncture formula, and clinical experience. SaAm Acupuncture class book is composed of 43 chapters from Chapter 1, Stroke, to Chapter 43, Hemorrhoidal Fistula, so it includes various types of disorders. Let me introduce the principle of SaAm Acupuncture's basic formula. 5 elements are composed of wood, fire, earth, metal, and water. Today I want to focus more on the movement and the interrelationship among the 5 elements. Basically, there are 2 major interrelationships, generating and controlling. The circulatory clockwise relationships are nourishing or Shung cycle, and these star-shaped relationships are controlling the Ke cycle. According to the 5-element theory, all phenomena in the universe are the products of the movement and mutation of 5 elements. So everything can be categorized into one of the 5 phase systems. For example, it includes season, climate, direction, development, color, taste, viscera, bowel, sense, tissue, emotion, and so on. SaAm acupuncture is based on the 5-element theory. Its basic prescription formula consists of 5 element points and 12 major meridians. Each organ and meridian belongs to one of the 5 elements. There are also 5 element points in each meridian. For example, liver is the wood meridian, but there are also 5 element points in the liver meridian. As you can see in this picture, all 5 element points are located between the fingers and elbow or between the toes and knee, but not on the body trunk. This table shows the real 5 element points in our body. These points are very important and useful in creating acupuncture prescriptions when using SaAm principles. In the West, meridians are commonly called by an associated organ name. For instance, lung meridian and river meridian. However, the original full name of the 12 meridians has deep, profound significance. First, original name implies this pathway by hand or foot. Second, it indicates character according to energy axis. This energy axis of a 3 yin and yang system is linked directly to the 6 energy system. This is crucial because this energy system establishes the characteristics of each meridian. Third, it implies relevant organs, as you know, and each organ belongs to one of the 5 elements. In traditional East Asian medicine, often categorizes disease and symptoms into 2 patterns. There are deficiency syndrome and excess syndrome. Deficiency syndrome implies that the vital energy is comparatively chronically insufficient, weak, and unable to perform former function. This is more common in chronic stage of illness. The deficiency pattern generally manifests pain, which is relieved by pressure, pale complexion, shallow breathing, incontinence, cold limbs, pale tongue with a little mouth and empty, thin, weak pulse. On the contrary, excess syndrome implies that the pathogenic factor or imbalance of an inter-organ relationship causes overfunction or malfunction of specific organs. This is more common in the acute stage of illness. The excess pattern generally manifests pain, which is aggravated by pressure, flushed face, heavy breathing, scanty urination, high fever, red tongue with thick mouth, and strong, wiry, full pulse. The principle of combining 5 element points in SaAm acupuncture is as follows. Basically, there are two basic types of prescriptions for deficiency syndrome or excess syndrome. Each basic formula consists of 4 points. 2 points are selected according to Chapter 69 in the Classic of Difficulties, also known as Nanjing. In deficiency, reinforce the mother points. In excess, reduce the child points. In addition, 2 controlling points of the target organ element are added. In deficiency, reduce the controlling point. In excess, reinforce the controlling point. For your better understanding, let's use an example. If river meridian is in deficiency and the patient has fatigue, blurring of vision, irregular menstruation, and dizziness. In this case, reinforce the water as mother to boost its childhood, and reduce the metal as wood controller in order to block metal suppressing effect on wood. These 2 ways of manipulation will revive wood function in deficiency. This illustration is showing the real point. If liver is in deficiency, reinforce the water points of water meridian, kidney 10, and water point of river meridian, liver 8. And reduce metal point, metal meridian, lung 8, and metal point to liver meridian, liver 4. Let's see the excess case. If liver meridian is in excess and the patient has hot temper, flank pain, muscular pain, and conversion. Reinforce the metal in order to strengthen metal's control over wood, and reduce the child fire in order to consume wood energy by fire in the nourishing cycle. These 2 ways of manipulation will help suppress the overactive wood energy. If the liver is excess, reduce the fire point of fire meridian, hot 8, and the fire point of the liver meridian, liver 2. And reinforce the metal point of the metal meridian, lung 8, and metal point of the liver meridian, liver 4. The principle of combining SaAm acupuncture points looks complicated at first, but there's no need to worry at all. This is the ready-made basic formula chart for you. Please keep this table for your reference in case you may want to try SaAm acupuncture. Moving on to the needling technique. Needles are sterile, disposable, commonly needles. The diameter can be 0.2 36 gauge to 0.30 millimeters 30 gauge. The common length can be 15 to 30 millimeters. The needle length may depend on the point, depth, sensitivity, etc. Each needle is retained for 20 to 30 minutes. Opposite side of symptoms should be preferred in most cases according to old classic principles. However, modifications can be made according to specific patient condition and environment. Now let me introduce what are reinforcing and reducing techniques. There are various kinds of reinforcing and reducing manipulation techniques in classical acupuncture books. Other needling techniques can be combined if necessary, but common techniques for SaAm acupuncture are shown in this table. Reinforcing technique means inserting needles along the meridian flow, inserting needles in exhalation and removing needles in inhalation, rotating needles clockwise. On the contrary, reducing techniques means inserting needles against the meridian flow, inserting needles in inhalation and removing needles in exhalation, rotating needles counterclockwise. This picture will help you understand better. Yin meridian flows upward and yang meridian flows downwards. Reinforcing technique means inserting needles obliquely along the meridian flow. On the contrary, reducing technique means inserting needles obliquely against the meridian flow. Rotating needles clockwise is a reinforcing technique, and rotating needles counterclockwise is the reducing techniques. Now let's move on the clinical application of SaAm acupuncture. We can compare a patient to a puzzle. Some patients have simple and easy symptoms like this puzzle, but some patients may have various complicated symptoms like this puzzle. Solving this simple puzzle is not a problem, but if you meet this complicated puzzle, you have to consider the whole picture. Just focusing on each individual piece is not so helpful. This is another popular puzzle, Sudoku. You have to write from 1 to 9 in this 3 by 3 square. And also this 9-cell column and row at the same time. You have to keep searching the relationship with other numbers as a whole, or you cannot get the answer. So what I want to say is that targeting one or a few dominant symptoms for treatment without considering the whole picture may not be successful. Some practitioners ask which acupuncture points are effective for such and such symptoms, but the better question would be which points are effective for the patient rather than some symptoms. As you see, some patient has many different types of symptoms at the same time. Like a prism, you can reorganize and analyze patients' complicated symptoms or syndromes through the five-element theory to decide the primary target element or meridian for treatment. There are three ways to select the target treatment meridian. First, determine the pathway of meridian at the site of symptom area. Second, determine the target organ and its system, including emotional and mental health, according to the five-element theory. Third, determine disease patterns according to six energy systems, for example, dampness, coldness, etc., and determine the target meridian. You can find a certain point through coordinate of the x, y, z axis. It is the same with SaAm acupuncture. The target meridian can be found through three principles, which are site of area, five elements, and six factors. Find out which meridian passes at the site of symptom area. Small intestine, for example, small intestine meridian for scapular pain, bladder meridian for sciatica of the back of our leg, large intestine meridian for upper teeth pain, stomach meridian for lower teeth pain. This approach is relatively simple and easy to select the treatment meridian. Next, think about five-element systems. For example, kidney meridian for ear problem such as tinnitus, lung meridian for skin trouble, liver meridian for anger control, and so on. In the West, meridians are commonly called by associated organ name, for example, lung meridian or liver meridian. However, the original full name of the 12 meridians has deep and profound significance. First, the original name implies its pathway by hand or foot, and second, it indicates character according to energy axis. This energy axis of three yin and yang system is linked directly to the sixth energy system. This is very important because this energy system establishes the characteristics of each meridian. Third, it implies relevant organs, as you know, and each organ belongs to one of the five elements. There can be two attitudes toward traditions. First, reject traditions until they are fully explained and proven scientifically. The other is to follow traditions until they are fully disproved as usuries. My personal choice is the second one, as the traditions have survived throughout history and have been handed down to us today. Still, it is worth of research and development, especially if it is not dangerous and it is safe. Here is another example. Let's say a person has skin problem. Skin belongs to metal system. Metal organs are lung and large intestine. The difference between the two depends on the sixth energy system. Lung meridian is tie-in meridian, greater in meridian, which is related with dampness. So tie-in lung meridian is useful for dry skin or dry hair. However, large intestine is Yangming meridian, and it is related with dryness. So Its clinical application to use large intestine meridian is for stomach dampness syndrome, for skin problem like oozing or pus. In addition, small intestine meridian is Tai-yang, which is related with coldness. So small intestine meridian can be effective for burns and blisters for its cooling effect. So tonifying small intestine meridian is one of my favorite SaAm acupuncture formula. As I mentioned before, small intestine is Tai-yang meridian and it is related with coldness. And heart and small intestine is related as a couple. So heart is related to blood and small intestine is also related to blood. So it can be helpful to use for blood deficiency syndrome and postmenopausal syndrome, menstruation, and it passes through our scapular area, small intestine meridian, so it can be helpful to improve scapular area pain. And for its cooling effect, it can be applied for the burns. And also blood stagnation syndrome, stabbing pain, or rheumatoid arthritis. For rheumatoid arthritis, small intestine meridian formula, tonifying small intestine meridian formula can be applied. Tonifying lung meridian. Nose belongs to lung system according to 5 element system. So nose disease can be treated by tonifying lung meridian. And hair and skin is also related with lung meridian. So hair loss or dry skin, dry hair can be treated by tonifying lung meridian. Because lung meridian is a tie-in meridian, it is related with dampening, so it can treat dry condition. And vice versa, tonifying large intestine meridian is large intestine is Yangming meridian, and it is related with dryness. So it can treat too much dampness in our body. So it can be helpful to treat obesity and skin condition like oozing and pus. And according to the pathway of large intestine meridian, the lower toothache can be improved by tonifying large intestine meridian. Now let's briefly review indications of 12 meridians. First, lung meridian. The functions of the lungs: it governs qi and respiration, control channels and blood vessels, controlling dispersing and descending, regulate the water passages, control skin and hair, open into the nose, house the corporeal soul. So the lung tonification formula is reinforcing spleen 3, lung 9 points, reducing heart 8, lung 10 points, according to the basic principle. So it can be helpful to treat dryness, qi deficiency, sweating, rhinitis, chronic cough, dandruff, cataract, right hypochondriac pain, skin trouble. Lung sedation formula includes heart 8, reinforcing heart 8, lung 10, reinducing kidney 10, lung 5. Phlegm retained fluid, retching, acid, regurgitation, gastric upset, dry retching. These kind of symptoms can be treated by sedating lung meridian. Let's see large intestine meridian. The functions of the large intestine: it controls receiving and transforming, and it separates fluids. Large intestine tonification formula is reinforcing stomach 36, large intestine 11 points, reducing small intestine 5, large intestine 5 points. It can treat subcutaneous node of neck, periodontal disease, intense lower back pain, dermatolysis, dampness, prolapse of the rectum, constipation, or diarrhea. Large intestine meridian sedation formula is reinforcing small intestine 5, large intestine 5, reducing bladder 66, large intestine 2. It can treat cord-related pain. Stomach meridian. The functions of the stomach. It controls the rotting and ripening of food, controls of the transportation of food essences, controls the descending of qi. It is the origin of fluids. It is related with the spleen as a couple. Stomach tonification formula is reinforcing small intestine 5, stomach 41 points, reducing gallbladder 41, stomach 43 points. It can treat stomachache and vomiting. Stomach sedation formula is reinforcing GB, gallbladder 41, stomach 43 points, reducing large intestine 1, stomach 45 points. It can treat flesh pain. Spleen meridian. The functions of the spleen: carbon transformation and transportation. It controls blood. It controls the forelimbs. It opens into the mouth and manifests in the lips. It controls the raising of qi. It houses thought. Stomach tonification formula is reinforcing heart 8, spleen 2, reducing liver 1, spleen 1. It can treat water stagnation, abdominal fullness, gastric upset, vomiting. Spleen sedation formula is reinforcing liver 1, spleen 1, reducing lung 8, spleen 5. It can treat fixed pain. Heart meridian. The functions of the heart: it governs blood, controls the blood vessels, manifests in the complexion, houses the mind, opens into the tongue, and it controls sweat. Heart tonification formula is reinforcing liver 1, heart 8, reducing kidney 10, heart 3. It can treat heat stroke, low blood pressure, inner canthus, palpitations, fear for throbbing, neurogenic tremor. Small intestine meridians. Small intestine tonification formula is reinforcing gallbladder 41, small intestine 3 points, reducing bladder 66, small intestine 2 points. It can treat blood disease, blood deficiency, blood stagnation, vessel impediment, scapular pain, skin vesicles, herpes zoster, varicella, burn, stabbing pain, and women's disease, including menstrual problem or infertility. Bladder meridian. The functions of a bladder: it removes water by qi transformation. Bladder tonification formula is reinforcing large intestine 1, bladder 67, reducing stomach 36, bladder 40. It can treat headache, especially the occipital lesion, back of the head, and it can treat hypertension. Kidney meridian. The functions of the kidney: it controls opening and closing, it controls strength and will, it is the root of pre-heaven qi. Kidney tonification formula is reinforcing lung 8, kidney 7, spleen reducing spleen 3, kidney 3 point. It can treat nocturnal emission, myodispopsia, tinnitus, deafness. Pericardium meridian. The functions of the pericardium: it protects the heart. Like the heart, it governs blood and houses the mind. The pericardium houses the mind with the heart. Phlegm in the pericardium will cause mental confusion and, in severe cases, mental illness. Pericardium tonification formula is reinforcing liver 1, pericardium 9, reducing kidney 10, pericardium 3. Because it starts from our armpit, so it can treat armpit odor and memory impairment. Triple energizer meridian. The functions of the triple energizer: it mobilizes the original qi, Wen qi. It controls the transportation and penetration of qi. It controls the water passages and the excretion of fluids. The upper burner is like a mist. The middle burner is like a maceration chamber. The lower burner is like a ditch. The triple energizer concept, there is no concept in the Western medicine, so it would be some difficult to understand at first. Please refer to other reference books to more understand about triple energizer. Triple energizer tonification formula is reinforcing gallbladder 41, triple energy 3, reducing bladder 66, and triple energizer 2 point. It can treat circulatory disturbance, psychological trauma, obsession. Gallbladder meridian. The functions of the gallbladder: it controls judgment and it is related with liver. GV tonification formula is reinforcing bladder 66, gallbladder 43 points, reducing large intestine 1, gallbladder 41 points. It can treat the easily frightening flank pain and hip joint pain. GV sedation formula is reinforcing large intestine 1, gallbladder 41, and reducing small intestine 5, gallbladder 38. It can treat moving pain and phlegm nodes. Liver meridian. The functions of the liver: it stores blood, it ensures the smooth flow of qi, controls the tendons, manifestation in the nails, opens into the eye, it houses the ethereal soul. Liver tonification formula is reinforcing kidney 10, liver 8, and reducing lung 8 and lung 4 points. It can treat night blindness, left hypochondriac pain, tendon pain, and genital organ problems. Liver sedation formula is lung aid, liver fall, and reducing heart aid and liver 2. It can treat disease from wind heat. This is my translation book for SaAm Five Element Acupuncture. It is just a translation of classic books. It is not a guidebook yet, so it is somewhat complicated and difficult to understand by itself. But I try to make a new guidebook for beginners soon. Now let's talk about 3 cases. It's imaginary cases for learning. So case 1, 33-year-old woman who has migraine, fever, bitter taste, nausea, chest discomfort, hip joint pain, sticky yellow coated red tongue, wiry pulse. Case 2, 9-year-old girl, headache on the front, facial numbness, indigestion, anorexia, cold limbs, white coated tongue, weak pulse. Case 3, 65-year-old man, headache at the back, neck stiffness, lower back pain with sciatica, incontinence, and enuresis, white coated pale tongue, and slow pulse. If this patient visits your clinic, what will you do for this patient? Okay, case 1. The answer is sedating gallbladder meridian, because it is a excess gallbladder meridian syndrome. According to the pathway, gallbladder meridian, it goes our side of our head, and fever and taste, nausea is a gallbladder symptoms, and chest discomfort, and also the hip joint pain, hip area is also a gallbladder meridian pathway. And in traditional East Asian medicine, tongue and pulse diagnosis is important to make differentiation between deficiency syndrome and excess syndrome. Sticky yellow coated red tongue and wiry pulse is excess syndrome. So this is a gallbladder. This is more related with gallbladder meridian functions and symptoms, and it is more excess condition rather than deficiency. So we should reduce gallbladder meridian. So our point is reinforcing large intestine 1, gallbladder 44, and reducing small intestine 5 and gallbladder 38. Case 2. The answer is reinforcing stomach meridian. Our face and forehead is related with our stomach meridian according to the pathway. And indigestion, anorexia is a stomach function problem. And cold limbs, spleen and stomach is related to our 4 limbs. And cold limb means the circulation of our 4 limb is not good. So it is more stomach meridian overall. And white coated tongue and weak pulse, it shows she is in deficiency syndrome, not in excess syndrome, because weak pulse and white coated tongue is more often in deficiency syndrome. So, tonifying small intestine meridian, the formula is tonifying small intestine 5 and stomach 41, and reducing gallbladder 44, stomach 43. So you can see the acupuncture point in this picture. Case 3. 65-year-old man. Okay, the answer is tonifying bladder meridian. Headache backside. Back of our head is a pathway of bladder meridian. And neck stiffness and lower back pain with sciatica is a pathway of gallbladder meridian. And incontinence, urinary incontinence, and enuresis is more related with bladder function, urination. And white-coated pale tongue and slow pulse, it shows he is in deficiency. So bladder meridian and in deficiency condition, so we need to tonify his bladder meridian. So the formula is large intestine 1 and bladder 67 and reducing stomach 36 and bladder 40 point. This is final take-home messages. First, understand the meridians, its functions and pathways, and learn about also 5 elements and 6 energy. Think about meridians and try SaAm acupuncture, and practice makes you perfect. Thank you very much.